Like to call Professor Sajid Maqoob, our chief guest, for his remarks, as he wants to leave early, so we want his remarks early. Thank you very much, sir.
Bismillah ar-Rahman ar-Rahim. Professor Sibwa, Dean, Professor Kashif Malik, Professor Haroon, distinguished professors, young medical students, nurses, ladies and gentlemen. For those of us who live in Lahore, March is a happening month, Dr. Haroon. But I thought March was known for a number of other things, like Spring Festival.
Shakespeare said, "Beware the Ides of March."
Right. The Fairs Mela, the Lahore Literary Festival, the Dachi Mela, the Tattoo Show, Lahore Horse and Cattle Show, the Industrial Exhibition. But now I think we have to remind ourselves that there is something perhaps more important that we have to look forward to every March. And I am absolutely delighted and honored indeed that you have asked me to come. The hospital, the institute that you're sitting in, and this is for the youngsters, is one that we cherish a lot. It has very rich traditions, and it has had, over a period of so many years, some excellent departments. And when I say that GI has always been one of our strongest departments in this hospital, I'm not exaggerating. This, of course, does not mean that the others have not been as important. And perhaps the Department of Surgery is just as well known, has always been well known in this hospital compared to others, not only in the city, the province, for that matter, the country. So I am absolutely delighted that the two departments have collaborated for such a worthy cause. Now, we welcome you, sir. Aye. I'm told that he's the Ruhe Rawan of GI these days, so most welcome. So, most of you sitting here might think that when you think of a doctor, you're thinking of treatment. And treatment when a patient becomes ill, is sick with one condition or another, whether that be medical, surgical, or whatever. But another very important work that physicians and surgeons do is to raise awareness, and raise awareness about conditions that, if they are caught early, will not have the same devastating effect that they would if they were not caught early. And cancer, of course, is one of them. I'm sure you're all aware of awareness programs about other cancers, but I'm so glad that we are focusing our attention on this very, very important. Now, depending on who you talk to, it might be the second commonest cancer, it might be the third commonest cancer, but certainly is a very common cancer. And remember that we follow the tradition of, at times, the West, but we have our own problems, and we should chart our own course, and we should consider what is more important for us. And raising awareness about simple screening will, of course, help the population at large. I remember many, many years ago, most of you are too young to remember, when one of the presidents of the United States, Ronald Reagan, you might remember, that is when this issue of routine colonoscopy was put into place, at least in the United States. And then it became acceptable and it became what we call covered by insurance, and anybody over 40 years at that time had to have a colonoscopy. I think these days the age is 45, between 45 and 75 in the United States, maybe 50 here, but whatever, we set our own standards. So I'm extremely delighted to be a part of this very, very, very important occasion, and I'm glad that the two departments have gotten together and are going to not only make people aware, make the youngsters aware, make the population aware, but also be able to then, over a period of a few years, tell us the exact incidence of what is happening with our population. So remember, this is progress, and that is what we stand for. And thank you again for inviting me. I'm absolutely delighted.